My name is Rebecca Porter, and I'm a medical oncologist in the gynecologic oncology division here at Dana-Farber, and I treat patients that have cancers of the ovary, the uterus, and the cervix. I enjoy really getting to know my patients when I first meet them, not just what about their cancer is unique, but what makes them unique as a person, keeping in mind their goals and their wishes and their dreams as we embark on a long, journey together through their cancer care. What I really love about my job is that I'm able to both see patients in the clinic and spend a good portion of my time doing research. That allows me to identify the most pressing research questions from seeing patients in clinic, bring them into the lab to study and hopefully understand more, develop and run clinical trials, testing those results and hypotheses, and ideally bring those results back to patient care to improve outcomes for women. For a long time, we didn't really have that many other things to offer besides standard chemotherapy and surgery, but in the last several years, we've learned a lot about the molecular basis of these cancers, and that provides us with really exciting tools that we're now using here at Dana-Farber routinely in most of our patients, where we can take a deeper look at each person's cancer in particular and understand more about what's driving their disease, what may predict how they would respond or be resistant to a particular treatment. And that gives me a lot of hope. We now have the tools to extend those analyses to try to understand what drives the responses and what may drive resistance and how to work around that. And I think the coming years are going to be even more exciting as we learn more and more. Without a doubt, what I love most about my job is taking care of patients. I think the science is so exciting and I really enjoy being in the lab, but without that piece of really making these therapeutic alliances with patients and watching them and how brave they are going through their cancer care and being able to travel that journey with them, I don't think it would mean nearly as much.